Hi, welcome to this episode of Detroit Peds Talk. Happy New Year. Well, at Wayne Pediatrics, we are so concerned with the well-being of our infants and our pregnant mothers. And to begin the new year, January is Birth Defect Prevention Month, and I am so excited to welcome one of our general pediatricians, Miriam Behar, who is here to help us kind of think a bit more about how we can be supportive to our moms and their yet to be infants. And so she's going to share with us some really good information that moms to be might find helpful. So thank you so much, Dr. Behar, for joining me.
Happy to be here.
Yes. So Birth Defect Prevention Month, very important topic. Talk to us a little bit about what are some pre-pregnancy actions that are important to take, like screenings and so forth, so that moms and babies can be healthy.
Great. Yeah, absolutely. Pregnancy is a pretty exciting time. It's been almost 36 and 34 years for me, but I still remember it, being an incredibly exciting time. And I think, modern medicine has come such a long way in terms of preventative things that you can do during pregnancy to make sure that you have a healthy baby. I'm actually watching this great TV series called Call the Midwife, and this took place in like the 1950s and 1960s in London. And most of the deliveries were done at home. This is a very poor area. And so, there were babies that were stillborn and with birth defects and that sort of thing. So, and we see so much less of that now, now that we have good obstetrical care and, good safe hospital births. So basically, I think there's a lot that you can do to make sure that you have a healthy pregnancy and the outcome being a healthy newborn. As soon as you find out you're pregnant, you want to establish prenatal care. Usually if you have a primary care provider, they can usually refer you to a practice that can go ahead and follow the pregnancy and then make plans for the delivery. And it's often a physician that's an obstetrician. Sometimes it can be a nurse midwife, depending on the practice. A lot of our babies that are born at Hutzel see nurse midwives either upstairs from us at Wayne Health, or they see them over at University Healthcare. And they're wonderful and do a great job with prenatal care and delivering babies. So you want to establish prenatal care. I think that's the first most important step. And then there are some other things that we recommend. So it was discovered a number of years ago that if you took a vitamin called folic acid, it actually could prevent what we call neural tube defects. Those are babies that are born with like a gap in their spine, so it's like a spinal cord injury, basically. So it's actually recommended if you're thinking of getting pregnant, even if you're not pregnant yet, it's recommended to start taking that right away. They actually say it's good to have it on board at least a month before you get pregnant. So if you are of childbearing age, the recommendation is actually to take, it's 400 micrograms of folic acid a day. And you can, it's something you can get at the grocery store. It probably isn't a multivitamin, but you do want to make sure if you're just using a multivitamin that it has the 400 micrograms of folic acid, no less than that. It can be a little bit more, but at least 400. So that's number one, and that is something that we try to pass on now to young women of childbearing age, even if they're not pregnant yet, to go ahead and start taking the folic acid, because then if you do become pregnant, you have it on board, and it'll prevent those types of birth defects. You yourself want to take care of your body. So you want to, go for your regular checkups, make sure that you're fully vaccinated, that, especially like your tetanus vaccine is up to date. We do highly recommend both flu vaccine and COVID vaccine, especially during this season. Even if you might still get those illnesses, you might not, but if you do, that you usually won't get as sick. And especially if you're pregnant and you get sick with those illnesses, you could get dehydrated or have a lot of respiratory problems that could affect the baby down the road. So get vaccinated. If your vaccines aren't up to date, try to do that either through the health department or with your primary care provider. Take care of your body in other ways too. Eat, healthy diet. So, fresh foods, ideally at least 5 servings a day of fruits and or vegetables. Avoid processed foods. Drink lots of water. Drink milk or other calcium containing things like eating yogurt, dairy products, so that you get enough calcium in your body. It's also important for milk production. Avoid sweetened beverages. We say you don't need soda, you don't need even fruit juice. Just drink water, and then if you can drink milk or a milk substitute like almond milk or soy milk, at least a couple of servings a day. And get exercise. Exercise is, even when you're pregnant, it's important for your own state of mind. It's relaxing, especially if you've got a job that's stressful. Getting some exercise either in the morning or after work. Doesn't have to be, marathon running or anything, even just a half hour a day of something like brisk walking or biking or jumping jacks in place or something like that. If you are pregnant, talk to your doctor about what types of exercise they recommend and if there are any restrictions. But it is good to get exercise pretty close up to the time that you deliver. And then I think one of the most important things that I wanted to talk about today was using or partaking in any sorts of substances when you're pregnant. Alcohol is known to cause birth defects. On the more severe end, actually something called fetal alcohol syndrome. So really don't, if once you find out you're pregnant, don't drink at all. It's not worth the risk. They say even a small amount of alcohol can have adverse effects on the baby and brain development and that sort of thing. Do not smoke cigarettes. And I think the most important thing I'm going to talk about today is marijuana. This information came from the American College of Obstetricians and Gynecologists. So they're the ones that take care of pregnant women and deliver the babies. So it can interfere with brain development. Babies can be smaller. And this is the same actually for women that smoke cigarettes. There is also a higher risk of stillbirth. Nobody wants that. There's a higher chance of premature birth, and it's again both with marijuana and with cigarettes. And then after birth, if you continue smoking, the baby, especially if it's around the baby can have harmful effects from the secondhand smoke. And I even tell my parents that smoke marijuana, I say, if you do smoke outside, wear something so that you can hang it up and so you don't bring it in on your clothes, basically, because there's even something called third-hand smoke that can affect the baby. And then longer term, there's good evidence now that babies that are born to moms that have smoked marijuana during pregnancy can have more behavioral problems later in childhood, including trouble paying attention in school, what we call ADHD. And then there's just the effects that you can have from smoking marijuana on yourself. It also can affect reasoning and cognition. It's not safe to drive when you've been smoking, and it can actually cause damage to the lungs. In the moms that are smoking.
Yeah, and I'm so glad that you brought that up, because the more information that our families have, the better informed they are about the choices that they make. As we think about preventing birth defects and both mom and baby being healthy once the baby is born, we want to just be mindful about how the substances moms are using and the lifestyle and the practices and the behaviors can all contribute to the well-being of the unborn. So we know that people sometimes manage stress by using substances or engaging in behaviors that aren't always healthy. So it's not about being a bad person. It's about partnering with your medical practitioners, your primary care doctors, your OB-GYN, your pediatrician, to figure out ways to find healthy support to prevent some of those birth defects.
Stress, I think we all have stress in our lives now, and I think especially if you're pregnant and trying to hold down a job, partner with your provider if you're feeling stressed, to let them know, and they may be able to suggest some ways that you can de-stress. There are some mindfulness things that you can do to de-stress that don't involve using substances. So
yes, absolutely. Well, thank you so much, Dr. Behar, for this wonderful information. Hopefully, this is helpful to some of our future moms out there. And, we have some resources that are available if you'd like to learn more about helping your baby to be born healthy. So thank you so much for this episode of Detroit Peds Talk. Please visit our website or our social media platforms, Instagram, Facebook, for new episodes posting monthly. And remember, pediatricians are the best source of health care for your child. Thank you so much.